Good afternoon, everyone, and thank you so much for joining the Animal Welfare Group Nigeria. I'm so excited to have you participate in our webinar this afternoon. You're highly welcome. Feel free to introduce yourself in the chat. Let's know who you are and where you're joining us from. I am Dr. Iyasiri Oluwaseun Sarah by name, and my area of expertise is farm animal behavior and welfare. And if today is your first time joining the Animal Welfare Group Nigeria, I would love to share you a little bit of how this group started. The Animal Welfare Group Nigeria was founded in the year 2019 after a gathering of researchers and students at the Federal University of Agriculture, Abeokuta, Nigeria. And we have three main missions. The first one is to increase awareness in animal behavior and welfare. And our second mission is to foster collaboration among stakeholders in animal welfare. And thirdly is to educate stakeholders on the importance of animal welfare. So we want to increase awareness and also educate and help foster collaboration. And with that, we believe we can bring a change to Nigeria, Africa, and to the world at large. So thank you once again for joining. We have a wonderful speaker in our midst this afternoon, and she is Anna. Anna is completing her Master of Science at the Ontario Veterinary College, University of Guelph, specializing in One Health. In collaboration with Veterinarians Without Borders, her research examines the role of community animal health workers in improving veterinary access in underserved regions. She holds an Honors Bachelor of Science from the University of Toronto, specializing in anthropology, health science, and psychology. With research experience spanning microplastic pollution, animal welfare, and community health, she is passionate about transdisciplinary collaboration, equity, and One Health. She has also served as a student representative, mentor, and accessibility volunteer. Hannah welcomes opportunities to connect and collaborate on research or initiatives that align with One Health and community welfare. You're highly welcome, Hannah. Hannah will be speaking to us today on the global analysis of community animal health worker programs, strategies for sustainable community health enhancement. So, we have an interesting topic before us this afternoon, and I'm so excited that learning about the community and health workers seems to be the first of its kind that we are going to be having someone present on this topic on this platform. Feel free to drop your questions during the presentation in the chat, and I'll be taking the questions immediately after her presentation. And yes, we want to make it as interactive as possible. Anna is a second year master's student, so as if your feedback would be very valuable to her on this research work. So thank you everybody for joining. I appreciate it. So Anna, over to you.
Yes. Thank you so much for the introduction and welcome everyone for joining the season. I'm very exciting to share my project with all of you. So, hello everyone. As mentioned, I'm Hannah. I'm now a second year master candidate in Ontario Veterinary College here, University of Guelph, Canada. So, I'm in Canada. Good morning from here. And thank you for all the good afternoon from Nigeria. So I'm very excited to present my collaborative project with Veterinarians Without Borders North America, Total Global Analysis of Community Animal Health Worker Program, CAL programs for short, Strategy for Sustainable Community Health Enhancement. So first, I would like to extend my sincere gratitude to BWB for these incredible opportunities to collaborate on this project. And also a very special thank you as well to all the advisory committee members and for their support and guidance throughout this journey. So before we delve into the more detail, I would like to provide a quick overview of the structure of today's presentation. So we will begin with some background information, discussing the general definitions and purpose of cow programs. From there, I will highlight the key knowledge gaps in the existing literature that we found, and also this project seeks to address, along with different primary objectives that we set out to achieve. And then we will move on to methodologies, where I will outline our research design, including the specific approaches and methods we use. And we will then take a closer look on both our quantitative and qualitative methods. We'll first look into the quantitative techniques that we use to collect and analyze data, and followed by an exploration of the qualitative aspects, including interviews and thematic analysis. And then following that, I will present our key findings, starting with results from quantitative analysis, and then discuss the themes that emerge from the qualitative data. And this will let us into a preview of the CAL program framework that we are now developing and refining on based on all our findings. And then we'll wrap up by discussing the significance of these findings, focus on their potential impact on sustainable community health enhancement. And then after that, I will outline the limitation challenges that we encounter during the research focus, like the whole research process. And then finally, we'll wrap up with future direction, considering potential next step that we recommend for research and implementation in this area. Okay, so to start off, so what are CAL programs? I'm sure like many of them probably have already heard of this term, just from like throughout my research. I have the opportunities to interview some people from Nigeria, and they're all amazing. And from my understanding, that how program is being quite mature and being running like with a lot of support in Nigeria. So just to provide some very basic information here. So community animal health worker programs commonly involving selecting local community members and training them in basic animal health care. And then this training is provided by mostly external professional veterinarians out of the communities and in collaboration with like different organizations, sometimes with government. The goals of this program is to offer essential medical services to community animals, particularly in remote and unserved areas. And several organizations that have run cow programs before or is currently running the program, including but not limited to World Health Organizations, World Veteran Association, Global Alliance for Rabies Control, and Veteran Without Borders, also among different others. So these programs are designed to provide low cost, convenience, and rapid access to primary healthcare service for animals and also preventive care. And particularly in area where traditional veterinarian clinics are limited or not available. Okay. So now we move to, and also like how programs were initiated to improve like local farm animal reproduction rates and control outbreak of zoonotic disease, and they have been implemented in different regions globally, including like Thailand, remote area of North America, Latin America, Africa, and Cambodia. So the training for cows typically lasts 2 weeks to a month and focusing on local disease and animal population with a tailored program, sometimes based on community needs. So based on all this information and the literature review that I've done, so even though cow programs have been successfully implemented in many different countries, they do face different type of challenges. So current literature reviews revealed like a several knowledge gaps regarding these programs. So these gaps include like a lack of detailed operational and systematic insights, such as how cows function on a daily basis and how to effectively identify and ensure the availability of different resource providers. And there is also a significant gap in strategy for improving community engagement and involvement with this program. Additionally, most cow programs focus primarily on farm and industrial animals, as mentioned before in the background, and with a little attention given to companion animals, pets, and working animals. So moreover, there are no evidence-based, data-driven standardized strategies or framework for ensuring the effective and sustainable operation of cow program across different regions, which is where our project came in. And our aim is to address these gaps by identifying effective and sustainable strategies and framework through the analysis of data from existing cow programs So this project is clearly data-driven and also evidence-based. So the goal of this research is to provide valuable insights that can help to enhance community health in remote and underserved areas. We are hoping to benefiting both current and future cow programs, as well as similar community-based animal health initiatives. To look more into the objective of this program, so we have three of them. The first one is to obtain insights and opinions on optimal strategy for addressing systematic issues in cow program, such as like resource allocation, identifying resource providers, improving data and record management, and managing medical waste. The second one will be we are looking to gather insights and opinions on effective strategies for enhancing community engagement and involvement within CAL programs because CAL program is a highly community-driven program, and this type of like strategies will including public education, zoonotic disease education, and fostering awareness of future animal healthcare career opportunities. So to build more local capacity, and then the third one will be to acquiring insights into the most effective strategy to ensure the sustainability of our program, including initiatives for continuous training, regular community meetings, and seminars. So by addressing all those gaps, we aim to develop a detailed but also very flexible framework that can be applied to most remote and underserved communities that need access to veterinary services. Okay, so to briefly talk about this methodology here. So this study employ and apply mixed methods approach with an exploratory design to gather both quantitative and qualitative insights into cow programs. So the recruitment was done by a targeted outreach using emails, social media platform such as LinkedIn, Facebook, Instagram. And we also focus a lot on collaboration with like reach out to different organizations to help distribute our recruitment materials. I think probably some of you have already seen this post on the right side being circulated around different platform or your network emails around last summer. So including email templates and our poster here, we will share them within the CAL related framework. And we encouraging participants to spread this information too. So for our data collection, it consists of survey and interviews. The survey were used for quantitative data, while our semi-structured interview provided qualitative insights into the experience and perspective of cow workers and also program designers, implementers. And for data analysis, we use semantic analysis for the qualitative data to identify key patterns and themes. And we use descriptive statistic data like analysis for the quantitative data to assess the trends and correlations between different factors. And this combination of methods allow us for thorough understanding of the data we have collected for cow programs and provide actionable insights for improvement. And then here now I will talk about our quantitative methods in detail before I jump into the result. So for the quantitative data collection, the survey were accessible through a QR code on the poster and also a link that provided in the recruitment email. Participants were screened for eligibility based on if they're fluent in English and if they're already an adult and if they have experience or is now participating in a CAL program. So the consent process was completed by a consent form provided in both PDF and image format on Qualtrics, which is also where our survey will deliver. And then during the data collection and cleaning, any incomplete or withdrawal responses will be excluded. So by the end, we were able to collect 28 valid responses for analysis, and the responses were organized and analyzed in Excel with the content function because with the like a large number of select all the all that apply multiple choice questions that we have and also our small sample size, I found that's more like minimal and suitable. And then for our qualitative, any qualitative responses within the survey, we extracted the other answers and we analyzed them in vivo with our qualitative script, which will be talked about in the next slide. And then any significant choices representing more than 32% online participants, we highlighted for clarity. And the key results were later converted into percentage for better visualization. So after the quantitative part, we look into the qualitative data collection. So we also recruit the participants through survey link or direct email responses when I reach out to them individually. And then the eligibility was confirmed through three screening questions, which is similar to the survey. And then the participant provide consent using a consent form. The interview one conducted through Microsoft Teams, which is like both me and all the participants' preference. And then the transcript were later verified by participants for accuracy and also serve as a very important member checking process. And then by the end, a total of 14 participants across 11 interviews were analyzed. So we used Brown and Clark's six-phase thematic analysis with a modified approach. Thematic codings was performed using auto-coding and followed by manual refinement and subcoding by myself. And this process will lead to the identification of 7 main themes and 14 sub-themes to serve as a backbone or like the start of our framework. Okay, so now I'll start to talk about some of our key survey findings. So first, regarding the geographic distribution of our participants, the majority of participants come from Ghana, which is 28%, and Nigeria, 25%. I'm so thankful for people from Africa who's willing to participate. And we also had participants from a variety of different other countries, but it's currently just one of them per country. So which including Australia, China, Guatemala, India, and many other countries, as listed on the page here. And then in terms of program status, we found that 79% of CAL programs are still running. However, those that have stopped often cite that they encounter challenges such as insufficient funding, community barriers, research limitations, and lack of support. As for the program duration and funding, 39% of the program have been running for like 3 to 5 years. The majority of the program are funded by NGOs, which is 57%, and followed by some of the government agency, which is 32%. And then next, let's take a look at the cow selection criteria preference. So we found that 64% of participants selected individuals. They have a preference to select individuals with previous experience with animals, and also a motivation to improve animal health have been like likely important. And then additionally, 54% emphasize the importance of the ability to speak the local language. And they do value their community position and their relationship with other community members within the community. And other criteria included literacy, statutory body requirements if government body is involved, and a preference for women and youth to empower their to empower them within the community. And regarding the resource securing, so 38% of participants mentioned that engaging businesses and cooperation is very important. 38 also highlight the role of government or other public sector support. NGOs were also frequently mentioned as important resource providers in our like other sections. And then in terms of key issues that have been addressed by CAL programs, the main focus area were zoonotic disease prevention, which covers 75%. And then livestock productivity, 71%, followed by livestock mortality, 64%. And other additionally concern or different type of issues that were addressed by CAL programs in like the other sections included animal welfare, women's empowerment, food security, One Health, and biosecurity. Okay, so in terms of program effectiveness, 36% of participants rated the program as moderately effective in improving financial stability and animal welfare. And another 39% they found them very effective in securing community buy-in. Additionally, 43% of respondents reported that the program were highly effective in addressing community needs, zoonotic diseases, and promoting economic growth for farmers. Furthermore, another 36% noted that the program were very effective in empowering women. And regarding essential equipment and supplies, 82% of participants identify medication as critical, which is pretty obvious. And 86% highlight the importance of educational materials. And 75% emphasize the need for record keeping tools. 68 mention the necessary of basic medical tools, PPE, and other hygiene supplies. So when it comes to training, 86% of participants receive instruction on disease identification and management, as well as record keeping, while 82% focus on animal knowledge, handling, and community engagement. And then this finding helped to underscore the importance of providing adequate resources and training to ensure the success and sustainability of COW program. So just to provide another last couple survey findings here. So the survey results on training and certification shows that the majority of cows receive certifications or licensing following after their trainings or like their examinations. So however, some cows they do notice that resource for daily activities are somewhat inadequate sometimes, and with 36% frequently referring to the training manual for guidance. And in terms of record keeping and reporting, a majority relied on paper-based system, but also with a combination that more than half of the participants also use digital system. So it really depends on like the accessibility and resource available within a community. So additional 43% of cows are required to report mandatory animal identification and treatment records. And regarding the service delivery, most respondents rated the service quality as high as 75%, reporting that no complaints have been reported or found. Additionally, 61% of cows they frequently provide follow-up visits, indicating quite a strong commitment to maintain care in the community. And when it comes to community outreach and supervision, 29% of cows engage in outreach every 2 to 3 months. So with the 50% of regularly consulting with their supervisors. So feedback is often gathered through group meetings or online chats such as like WhatsApp, and highlighting a collaboration approach to improve program effectiveness based on available resources. And now we are going to move on to some of the themes that we identified from the interview script, which is our qualitative themes. So the results reveal several key themes that reflect the success and challenge of the COW program. So the first theme that we identify is that community-based approach emphasizes the importance of community involvement. The first sub-theme highlights that important that like community-led programs are essential for engagement, goal settings, and finding solutions that work local. The second sub-theme focuses on sustainability, evaluating and emphasizing that long-term success really depends on community involvement in program development, selecting the right participants, and overcoming all the challenges. So to make sure that the community buy-in throughout the whole process and will be able to carry on the program independently afterward. And then theme two that we identify is the need for transdisciplinary program preparation, which shows that how crucial that collaboration is across different sectors. So first sub-themes that we emphasize more on to make sure that you have support from governments, communities, and professionals, where relationship, fundings, and policy are like definitely key factors to success. And the second sub-theme that we have is to mention about the value of diverse perspective, where collaboration and resource sharing help to enhance the program effectiveness. And then the third thing we have here is the local context-based program. Design help to address the need for understanding local conditions. The first sub-themes indicates that social economic factors is always something that we have to consider when you design or implementing a program. So such as community backgrounds and their healthcare accessibility, because those factors will contributing in shaping the program design. And then the second sub-theme highlights that the program need to address specific local needs, including animal populations, common issues faced by the communities. And that would be most effective if the issues are brought up or mentioned by community members, because they are the ones that understand most of their community. And then now moving forward to our theme 4 and 5. The theme 4 that we mentioned a lot on capacity building for sustainability focus on ensuring the longevity of COW program. The first something we talk about the importance of education and career opportunities, which contribute to the development of the workers' capacity and also the community capacity, and the roles within the community for long-term and sustainable program development. The second something we highlight the local engagement, showing that continuous feedback, motivation, like mutual connection, mutual relationship, and recommendations from the community are essential for sustaining the program long term. And then theme five we have here is for knowledge exchange and public education underscores the significance of sharing knowledge and education, like educating the public. Something one that covers program advertising and relationship building, where the development strategies and recommendation will play a crucial role in raising awareness and security. The second something we have here is to focus on public education, specifically through health events and outreach events, which will help to inform the community about key health issues and also the best animal health care practices, whether it's in home or in clinic. So now we have our last two themes here, which theme six that we put a lot of energies and content to talk about how cow programs and any similar animal welfare program would contribute to one health, explores the interconnection between humans, animals, and environment factors. So subtheme one, we highlight the importance of human-animal environmental interdependency with a focus on one health and overall well-being of the community. And subtheme two, we address the role of cows program play in community welfare improvement, emphasizing the effectiveness of the program in enhancing the overall public health and also the health of the planet. And then the last thing we have here is to emphasize the importance of continuous evaluation tools and like strategies for improving, emphasize the need for ongoing and continuous evaluation and data-driven improvement. First up thing, we focus on data for advocacy. So we can actually use those data to including like to driven economic strategies change and policies change to support and enhance different animal healthcare and cow like and any program similar to cow programs. And the second something we look at the importance of checking medications and disease data. So we want to ensuring that treatment strategies and record keeping process are continuously updated for programs as this. Okay, so as I mentioned before, based on all this data that we have, we actually able to come up with a framework. So because of the limited time that we have today, and also because I'm still working on refining the like a framework with VWP, so now I will provide like a preview of the framework. So starting with the introduction that provides an overview of the One Health approach, and then highlighting the importance of integrating animal, human, and environmental health, especially within CAL program. And then moving forward, we outline the program purposes, which include strengthening animal health services in underserved areas, enhancing disease surveillance, and connecting education and career opportunities for cows and also other potential members in the community who have a passion of animal health and are willing to contribute. And then we look into the program preparation section, which focus on engaging stakeholders like local communities, veterinarians, policymakers, so conducting needs assessment and also ensuring the ethical compliance. We also address social factors, such as like a cultural perception of animal health, gender roles, and social economic barriers. The framework also further emphasizes outreach and public education events to raise awareness about cow program, like about their roles and disease prevention, alongside integrating, like in some place would be indigenous and some place would be local knowledge. And moving on, we talk about selection, recruitment, and relationship building. They are key areas to ensure a community-driven process that builds trust and long-term partnership. And then we move to training and resource will help to equip cows with core competencies, practical training, and necessary tools. The implementation of strategy includes community-based service models, mobile veterinary care, and adaptation to local context. And then monitoring and evaluation will also ensure continuous feedback and improvement. And finally, the framework includes information about sustainability, resilience, and capacity building. So by focusing on long-term funding, local leadership, and knowledge transfer, while also tackling potential challenges like logistical constraints, policy pushback, and staff burnout. And this comprehensive framework will hopefully help to ensure COW's programs' effectiveness, sustainability, and community impact. So for now, because we are still working with BWB to refine some of the details for this framework, but if you are interested to get a copy of it when it's available or published, please do email me or reach out to me through LinkedIn. I'm happy to put you on our contact list and let you know once it's available. Okay, so just to wrap up with the last couple pages of slides here. So I will talk about the significance of this project. So by implementing a standardized framework for trials program is pretty essential to address existing gap in veterinary care delivery. Such a framework will help to provide a structured foundation for both current and future initiatives, facilitating strategy development and continuous improvement. And hopefully this standardized approach will help to enhance the accessibility and affordability of veterinary care, leading to a significant health and livelihood improvement within communities. And then by focusing on preventing and controlling zoonotic disease, the framework could play an important role in safeguarding public health. And additionally, it will help to ensure food safety and also could potentially contribute to building climate resiliency through sustainable practices in our climate change rapidly world. So these holistic strategies will help to benefit animal and human health and also promotes the overall well-being of our planet. And in summary, adopting this standardized evidence-based framework for cows program will help to address critical challenges and help to paving the way for a more healthier and more resilient future. So to talk about the limitation and challenge that this study, we do face several limitations and challenges. So in terms of recruitment, we encounter like barriers because most of like all of the survey and interviews are conducted in English only. And then also limited internet access could be a barrier because they're all virtual. And also a lack of incentive will probably hinder the participant diversity because we do not provide any incentive for our participants. And probably some members from the community, they do require some kind of participant in order to cover their schedule and their shift. And then when it comes to data collection, the time constraint for both survey and interviews could also limit participant engagement. So with the survey will take around 20 minutes and interview will last approximately like 60 minutes. So for people who have a very stressed and like a busy schedule, it might be not that engaged. And additionally, there might be potential power hierarchy within interviews because sometimes it's one on two interviews, which might influence participants' response and possibly affect the validity of the data. And for the analysis part, the reliance on like a single coder, which is just myself, probably will introduce potential personal bias. And the small sample size will probably limit the generalizability of the findings. And we do keep those in mind when considering like all the results. So to actually look ahead, so VWP COW program framework hopefully will be applied in real world setting to evaluate its impact and also to pinpoint the area for enhancement. And the key focus will be to engage a broader spectrum of stakeholders, including like cows and local community members. And we'll hopefully in the future we'll be able to gather more diverse perspective. And by addressing participation challenges such as like language barrier, limited internet access will help to involve using like local translators or offering more option of in-person or paper-based surveys for future studies. And to also deepen the understanding, we also recommend researchers to integrate qualitative methods like ethnography, which will hopefully to provide a richer insight into the community experience and ultimately refining the framework to align with community specific needs, will hopefully to improve its precision and effectiveness. And just a little acknowledgement here that I would like to express my thank you to my advisor, Dr. Lauren Van Petter, and on my advisory committee member, Dr. Batman, Dr. Clow, and Dr. Grant, and for their invaluable guidance and unwavering support throughout this project. I also extend special thanks to Van Petter's Lab and BWB North America for their generous funding and collaboration which made this research possible. And most importantly, I deeply appreciated the organizations and individuals that play a crucial role in the recruitment process and contributed to the overall success of this project. So their support has been instrumental, and I'm truly thankful about this. This is my references, and I have my last page here as a thank you page. So thank you very much for listening for me to probably rumble for a half hour here. So if you want to connect with me, or you are welcome to reach out through email or connect with me on LinkedIn. I'm happy to do that. And now I'm ready to take any questions, recommendations, or
Oh,
insight.
I really found this very interesting, but I have few questions. And also to all the participants, thank you so much for joining. Kindly drop your questions for Anna in the chat box and I'll pick it up from there. Yes, we need to look about into, how the community animal health worker program is like. And following your discussion, Anna, I realized that the a huge response you got was from Ghana and Nigeria, and I was wondering, uh, from the topic you present, you said a global, but the highest proportion was actually from Ghana and Nigeria. So I was wondering, don't you think that maybe this result is more representative of, is it West Africa now, than being a global representative? And also, the follow-up question to that is this interview ongoing or have you finished the data collection? Or what were the challenges you encountered while you didn't get responses from other countries that you wished to get from? So, yeah.
So thank you for the question. My cat is walking around here. Sorry. Yeah. So first to answer your question about this global analysis, so we do have like around a half of our participants are from Africa and the other half are from like around the world because like cow program is pretty specific program and a lot of countries they have not implemented any like community-based animal welfare program yet but we do have a couple like respondents that are from different countries that have like pretty different social context which I found really would be relevant as a global analysis and also I have around half of a number of our interview participants. They are actually they are actually from Northern Canada here, which is what I found would be also relevant to the global context. And then for the question about data collection, so the data collection have been done. That's why we moved to the analysis part, and the interview have been done because I have limited timeline for my
Program.
master. I would love to do more interview. Like all the people that I talk with and they share their insights are amazing people. Yeah, and I can always learn something new from them. Yes.
Okay, thank you so much. Are there any questions in the chat yet? No, no questions. Kindly drop your question, please, in the chat box. So, from what you have learned during this interview process and getting respondents to address this, what challenges did you actually encounter? And if you have to maybe say redo this, what would you have done better?
Yeah. So first, I would definitely start by the recruitment. So I would love to have different perspective and insights from actually the members within the community who actually receive the service from cows. That would be really relevant. Because now I'm interviewing mostly like the program implementers and CAPs themselves due to language barrier, what I mentioned before, and due to the internet access and also like the incentive that we are able to provide. So if I'm able to run this like project again, I would love to have some basic incentive that I can provide to people to either like cover their transportations or their access to internet And some challenges that I encounter for interview is actually because like a lot of those communities that cows provide service, they are either remote or underserved communities. So they do have very limited resource for veterinary cares. And some of them actually have to encounter a lot of very difficult decisions and traumatized experience. So where when they share that I do like feel a lot of sadness and difficult there. So that's would be the most hard things that I encountered for the interview.
Thank you so much. I appreciate that uh, discussion and your answer to the question. So
Thank
because
you.
it's always a learning process, you know. At times when you go through, there is no perfect research, right? You do something and subsequently, all right, you can improve on it in the future. There's a question from Ayola Oluyemi. Can you confirm you had 28 responses? And did you disseminate the calls for this interview? How did you put out the call before you were able to get 28? Was it through social media or what means did you do that?
So actually, as I mentioned in my slide, I have a little methodology there. Yeah. So thank you very much for the question. So we do have 28 responses for our survey and 14 responses for our interview. So for both recruitment for the interview and the survey, we posted a poster that I show on my slide there that we posted on LinkedIn, Facebook, Instagram, and I asked our Ontario Veterinary College to help to distribute it. And I also like reach out to different organizations who have any information they share about our program on LinkedIn or on like when I Google them. So I just send them the emails. I reach out to a lot of people and yeah, so those are the response that I'm able to get.
Oh, thank you so much. So you shared it across different social media platform and also through groups that you are.
Yeah, and also through individual emails. Like any people, if they publish their emails or their emails is accessible, when I search on website, I also reach out to the individual.
Okay.
So for the language barrier, it's actually across the whole country. So we do have people from Guatemala and who speak Spanish, which I'm not really able to contribute with, and also from like French spoken language, like countries if they want to also contribute because I know there have been CAL program implemented in like some areas of France, but we are not really able to conduct the interview because of the language barrier. And also for the internet access, I'm actually hoping that I'm able to actually do like a face-to-face interview rather than a virtual interview because that do cost a difference.
Health workers programs, established framework. Do you think the framework you showed to us, is it something that can work in different countries or how do you see the
So
application of it?
our aim is so what VWP North America, they're looking is that they know that around Global South, there have been a lot of successful case and experience with cow program already. So what they want to do is to gather some insights and relevant information about how we can implement this this program in Northern Canada communities. And what I found is so this framework would have a tailored approach to North America, but also is because I aim to make it flexible. So it's actually very suitable to implement in most of the remote and underserved communities. And I do provide space for modification. So organizations or groups or individuals or communities, if they're they will eventually have access to this framework at the end, and they will be able to use it and to probably make changes and modify them based on their local context.
All right, thank you so much. Thank you, thank you so much.
Thanks.
There's a follow-up question. Before the survey, has there been implementation of any of the programs in the countries surveyed? Hmm.
So if I understanding this question right, so from my literature review, I went over a couple of papers that they do have like done some survey in Africa, but they focus more on like a one tailor approach. Like I'm going to look at the quality of their service, or I'm only going to look at what type of training they receive. But there's no like a comprehensive survey on like the overall program structure from like preparation, implementation, sustainability, and then like the goal of the program community enhancement. And there's definitely a huge gap on how we can better do like a community-driven animal welfare program, or how we can maximize the community involvement and to make sure that community members and the community leaders that are always on board with us.
Yeah, Professor Konlade, if the question, if she's not getting it right, you can let me know so you can unmute and, ask properly. And if you are satisfied, please let me also know that you are satisfied with the response. So, Anna, I was wondering, when I was looking at the data you collected, since
Mhm.
this is a community animal health worker program, uh, what was it like in, I don't know if there's any question that actually asked or probed into the region of in within the community. How supportive are they? Whether how is it easy to organize a community-based animal welfare program? And this animal health workers, did you ask any question to know what type of animals they were really in touch with or interested in, something like that?
Okay. So to answer your first question would be, it really depends on the community, because most of them they do experience a lack of like access to care, especially veterinary care, and they do have encounter difficulty like zoonotic disease and like to like access to relevant cares and medications. So commonly the communities are very positive and they're really willing to this like this services. But the question is, every time when organizations or group they go into the communities, and if they do,
Okay, okay.
okay, yeah, to continue, yeah. So for this, that they commonly just like set up a pop-up or outreach clinic there for like a couple of days a week or like a couple of weeks a year, which is definitely not sufficient. Like the community members they like it, but that's not really helping in terms of long-term and sustainability and also like local capacity building for them to have their individual animal healthcare system. So now with the collaboration, it definitely involves more efforts to like hire professional veteran who's willing to provide supervision like when they are even not in the communities. But there's always a lot of interest from communities to collaborate, and a lot of them have the passion to care for animals. So they do want to become a cow in the community. So I would say it's relatively easy, but it just depends on how complete and how detailed you want to, like, how well you want to prepare for it before you actually kickstart the program.
Yeah.
And then your second question?
That was there
Yeah.
a preference for the type of animals this animal health
Okay.
worker, having or
So there's a little different depend on local context. So for some place that they do have like biosecurity and for safety issues, and also they rely on livestock for their livelihood. In this case, that cow program will mainly focus on like productivity animals and farm animals. So they can contribute more into like the overall social economic issues. But for Northern Canada there, they have more issue with dogs because they do have a lot of free roaming dogs that, well, dig into garbage, chase trials, or just like overpopulation. So, which is what happened in North Canada. So, and they don't really have a lot of livestock there because it's very cold. So it really depends on local context.
okay. Thank you so much.
Yeah,
Thank you so
thank you.
much. Yeah, we are almost getting to the end. Yeah, we have just 6 minutes to the end of the meeting. There is a question that just came in here from Abdurrahman. Should the cow members have prior knowledge in animal health before they are selected to be part of the program?
So that's actually one of the survey question that we ask about. So thank you very much for like bringing this up. So they have different preference and criteria based on different organizations, regulations, and also like which groups is actually facilitating the program. But the first and the most necessary components to be a cow is that they must be a trusted and have a very good relationship and reputation within the communities. So when they provide services, especially like when it's like life-threatening emergency services, they are trusted by the community members. So that would be before the experience or knowledge in animal health. It's not necessary to have animal health, but they do have friends to people who have a good status in the community, but also have interest in animal health or knowledge in animal health.
Okay, thank you. Race could be due to maybe, is it a lack of awareness or education within the population? And, talking about the need or the importance of having a community health worker program. And do you think most of the people you interviewed actually belong to one, or they just want to support that it's important that one should be available?
Like for people who actually joined and people who are interviewed, they do have a quite clear understanding of like animal welfare concern and what is need. And actually, they often brought up the topic of One Health. So they do like have an understanding, a very clear understanding, a very good understanding of the interdependency between human and animal environments. So I think what they want to provide would be more than just support a program. They really want to be part of a program because they do require a lot of dedications, especially like some of the program is volunteer only. So if they are willing to dedicate it all those times and efforts and also experience those tough situations, they are really dedicating into improving animal health and also to help deliver the awareness of animal welfare and public health information to different community members to help to bridge the gap. Yeah.
Yeah. So as a second year master student, I know in the audience we also have students in our midst. Do you have any words for them? Just something to say as students to students now. Yeah.
Yeah, so you might encounter some uncertainty and some challenges throughout your career or your academia life, but always, I won't tell you to always stay positive. It's not possible, but always stay hopeful and to believe that you can do something on the topic that you care, and you can actually help to improve the something going on in the world, even though if some people might not care about it, but there's definitely other groups that do care about it. So keep doing what you like, that you was your passion about. You will eventually have something good turn out.
Thank you so much. I really appreciate that. Yeah, you did amazingly well, and thank you for sharing your
Thank
research
you.
with us. It was so valuable and eye-opening. Thanks to everyone who joined, and your contribution was also massive and engaging. Enjoy your day wherever you are, and have a wonderful time. Have a wonderful day. Thank you so much. Thank you. So, lots of comments. Yeah, wonderful presentation. Thank you.
Thank
Thank
you so much.
Thank
And
you.
yeah, and yeah, thank you
With
for the
that,
opportunity.
yes, finally, I don't want to forget this. I just dropped in the chat. The Animal Welfare Group Nigeria is on Facebook, LinkedIn, and YouTube, and also on Twitter, which is now known as the X. Please do well to follow us so that you have notifications of subsequent presentations and meetings. Thank you so much, everybody. See you in the next 2 weeks. I think our next program is in the next 2 weeks. Have a lovely day. Bye for
Thank you,
now.
everyone. Take care.